let me start from breast cancer. What is breast cancer? So breast cancer is a malignant tumor that begins in the cells of the breast, and the disease occurs mainly in the women, but men can get it too, and the occurrence in men is only 1%. And breast cancer is the most common cancer in the women worldwide, and it is the second most common cancer in women in India. First one is cervical cancer, and there are some subtypes of breast cancer which are important to know as the treatment and outlook. That is the prognosis, what I call how many years the patient can survive, vary depending on the extent type of cancer. So how far the cancer spread and what does it mean? There are number of tools available to help doctors to decide which treatment someone should have the breast cancer. The treatment modalities is surgery, chemotherapy, radiation therapy, hormonal therapy, biological therapy or targeted therapy. And these tools look at number of factors about the cancer including stage. So stage is stage 1, 2, 3, 4. 3 and 4 is advanced stage. The stage of a cancer looks at how big the cancer is and whether it has spread the test. And scans, you have the diagnosing your cancer and give some information about the stage. The stage is important because it helps your breast cancer specialist to decide the best treatment for you. Suppose early breast cancer, the treatment of choice is surgery followed by chemotherapy followed by radiation therapy and hormonal therapy. Locally advanced, 3 cycles neoadjuvant chemotherapy followed by surgery followed by again chemotherapy followed by radiation therapy plus or minus hormonal therapy. In metastatic breast cancer, treatment of choice is palliative chemotherapy plus palliative radiotherapy. So the doctors put all the information into a formula or computer program which then gives some idea how will treatment and may work for an individual person with the breast cancer. So what are the treatment options? As I told previously, the treatment options are surgery, chemotherapy, radiation therapy, hormonal therapy like this. So various therapy are used for the treatment of breast cancer, that is removal of the tumor, that is surgery. Kills cancer cells with drugs, chemotherapy. Radiation therapy means it decreases the local recurrence. So that is external beam radiation therapy and brachytherapy. So depending on the size and spread of the cancer, the treatment can include any of these therapies and combination. When deciding what treatment is best for you, doctors will consider how big it is and how far it spreads. That is called metastasis. Your general health, that is called performance score, and whether you have experienced the menopause, premenopausal or postmenopausal. Then when will the treatment start and how long will the treatment last? After the diagnosis, it is necessary to start the treatment as soon as possible. You have to start as quick as possible. Before starting the treatment, it is important to learn about your option with the doctor. The length of chemotherapy treatment is determined by a variety of factors. In general, chemotherapy treatment is given in cycles. Chemotherapy treatment may be single drug or combination of drug. So the drugs may all be given on a single day, several consecutive days or consecutively as an outpatient, as an inpatient. So treatment could last minutes, hours, days depending on the specific protocol. So chemotherapy may repeat weekly, bi-weekly, 3-weekly or monthly. Usually a cycle is defined in monthly interval or 3-weekly interval. For example, 2 bi-weekly chemotherapy sessions may be classified as 1 month cycle. So what will happen if the patient does not take the treatment? After successful diagnosis of the cancer, if the treatment is not taken, it may lead to increase the tumor size, the tumor burden, and it will spread to the other parts of the body, which is called metastasis, which will decrease the survival chances of the patient. So if treatment is not taken, the cancer may spread to other parts of the body, which will impact the well-being and quality of life of the patient. So total quality of life of the patient is hampered. So what are the possible side effects of the treatment? So different drugs causing different side effects. So inform me if experience any side effects. Some side effects are also indicate that treatment medication is working. Common side effects caused by the chemotherapy drugs include fatigue, pain, sores in the mouth, sores in the throat, diarrhea, nausea and vomiting. We are calling it NVD syndrome, nausea, vomiting and diarrhea, constipation, headache, appetite loss and hair loss, that is called alopecia. And this hair loss is temporary. So most side effects of the chemotherapy disappear at the end of treatment. And myelosuppression, that means the blood counts decreases. So when the patient is on treatment, will the patient require any other test? Yes. When the patient treatment is advisable to undergo some tests to check the cancer status. Many a time tests are ordered to check the response of the tumor to the chemotherapy. That are we are calling subjective response, objective response and biochemical response. So during the treatment cycles like CT scan, MRI, PET scan may be advised to check the growth and spread of the cancer and monitor side effects. Depending on the observation from this test, the necessary changes may be made if required. So once the treatment is over, how often will the patient need a checkup? Follow-up care is important because it helps to identify late side effects, monitor general health and return of the cancer. The disease is reacquired. Disease is not regressed totally. So follow-up case visits are also important to help the prevention of early detection of the cancer, other type of cancer, address ongoing problems due to cancer or its treatment, and check for physical and psychological effects that may develop months to years after the treatment ends. So follow-up cancer involves regular medical checkups that include review of the patient medical history and a physical examination. In general, follow-up appointments are depending upon the requirements. So while on treatment, what do the patient need to be careful about? During your chemo, take special care of yourself. These are some basic things you should go, such as get plenty of rest, adequate rest, eat healthy foods and balanced diet, eat smaller but more frequent meals. 5 to 6 meals a day can reduce some of the stress on a digestive tract. Drink plenty of liquids between the meals, at least 1 hour before and after meals. Drink them warm or iced as you prefer, and also include vegetables, fruit juice. Avoid all fatty foods, avoid smoking and alcohols. They can cause problems with some chemo drugs. Keep thinking about the treatment goals. Dealing with chemo can be hard. A good way to handle the effects of chemo is also to remind yourself why you are getting it. Take time to enjoy your hobbies. Meditation and yoga may help you cope with the chemotherapy. So what if the patient call me in an emergency? If any time during or after treatment you experience symptoms other than what you were expecting, or if you feel much worse than you believe you should, it is advisable that you should seek medical attention immediately. Symptoms that warrant a visit to the doctor can include a single temperature above 101 degree Fahrenheit or a temperature above 100.4 degree Fahrenheit for more than 1 hour, especially if you are undergoing chemotherapy. Confusion or a change in the mental status, including the hallucination, difficulty in breathing, then a new rash, trouble swallowing, drooling or facial drooling from the facial, neck or tongue swelling, concern regarding the anaphylaxis, increased pain, difficulty in swallowing, headache, then abdominal pain that may be vague but it should be proper prioritized, constipation, uncontrollable diarrhea and uncontrollable nausea and vomiting, bleeding and swelling in the legs or arms. A oncologist, he should be that much brave. He should pick up the phone at any time because we are practicing cancer treatment. For a cancer treatment, cancer patient as well as the total family members, they have a severe mental stress, mental burdens like anything. So, an oncologist, you should not do only the treatment. You should be a good counselor, and you should do the counseling part very accurately. And you have to attend the phone like anything, so that patient cannot at the long way like 1000 kilometers, 500 kilometers away from Cuttack, from the treating place. They should not be feel ignored that the treatment is over, but the complications that the treating doctor is not managing. So that should be the motto. Thank you.